for anyone out there, doctor, that may be thinking and saying, oh, this is not too bad, what are they looking at? They go in, walk me through it. They go in and out, you know, 2 hours, 3 hours, 30 minutes? Dr. Powell?
Well, one of the first issues that people want to ask is, do I need to be asleep for this procedure?
That's a great question.
And the answer is no. In fact, there are times that, depending on where we're working, we want someone to be awake to control their breathing. We do, of course, make them comfortable with a combination of medications, but this is not something you need to be asleep for. Now, in terms of how long it takes, well, that depends on the severity of the disease. We can do procedures as quick as a half hour, but sometimes we're in for 2 and 3 hours, and sometimes it takes a whole lot of determination to get through some of these blockages. But again, it's not a particularly uncomfortable procedure for a patient to undergo.
And when they hear I can be awake, they're just thinking, this is fantastic. You know, you hear a whoosh, sigh of relief, right?
Absolutely.
A lot of people feel that way. So does this always work? And when it doesn't, what's plan B?
Well, I think in any therapy, you know, nothing is really always going to work. I think we have a very high success rate. A lot of times when you do this type of therapy, you're not really burning any bridges. So you may be able to come back and try again and try to get that vessel to function and get that vessel open. If it doesn't go the first time, it may necessarily be the second time. And then we have other options in terms of having to do a surgical type of bypass or procedure. You may be having some type of we actually sew an artery or vein across to bring the blood supply to that area that's not getting blood supply as an alternative in this type of situation.